Then we have scalp PRP combined with injectable dutasteride, combined with exosomes, combined with A-cell. Start to anti-aging.
Yep.
So candidly, I think this is a pretty interesting guy to follow. It seems to be quite transparent with what he's doing and tracking results. But we can go ahead and get into the protocol because he has similar interests in preventing hair loss, stimulating hair regrowth, and also helping to rejuvenate and improve the appearance of the skin. So we have a custom hair formulation here. This is publicly available on his website, and it contains some caffeine.
Okay, that's decent. Caffeine, 1%.
Some finasteride.
0.25%, so that about 30% of that's going systemic. So anytime somebody's on a topical finasteride, you're wondering, are they really trying to, are they not going to tolerate oral finasteride, or what's the reason why this is topical?
Yeah, and then minoxidil, sort of a whole cocktail of ingredients
5%
here.
5% minoxidil, pretty standard. The azelaic acid to, try to dry out the hair. And maybe take care of some sebum. Usually azelaic acid is not necessary unless you have a particularly oily scalp. Diclofenac 0.5%, that's Voltaren. That's interesting.
Yeah. To reduce inflammation, presumably?
Yeah.
So it's an NSAID.
It's no longer in vogue to have corticosteroids in hair. It used to be, there'd be like low to low moderate potency corticosteroid. And if somebody has an autoimmune cause of alopecia, then that still is reasonable from time to time, but you don't want to thin the scalp too much. But yeah, next is tea tree oil, 5%. I think this is in the intelligent volumizing shampoo that we call ketoconazole shampoo. So this is also reasonable. Rosemary, ginkgo biloba, biotin, 0.01%. It's kind of funny that there's biotin, and then low dose melatonin, which is also a reasonable ingredient.
Yeah, and I sort of wonder about how each of these is affecting the permeability of the scalp, mainly for the absorption of finasteride. I imagine if you have a couple of those things in it that are oil-based, that they're sort of encapsulating that finasteride or making less of the solution evaporate, and you're getting probably more absorption than you would if it was purely an aqueous solution.
Yeah. And we just did a podcast that we can link here on our own hair loss protocols, what we do during fertility phases, what we do when we're not in a fertility phase. I call it health phase. Not that fertility phase is an unhealth phase, but we'll link that here. People know that I'm a fan of topical ketoconazole, shampoo, tea tree, pumpkin seed oil in some cases. But in general, if you're going to have that many things, that's not a formulation that is ideal for most people.
Yeah. And again, kind of, is the juice worth the squeeze once you get past the really the first three ingredients there?
So biggest bang for the buck is minoxidil. After that, your finasteride or dutasteride. And then everything else is really secondary and on a as needed basis.
Then we have scalp PRP combined with injectable dutasteride. Combined with exosomes, combined with A-cell. So the PRP, the cadence here is pretty reasonable, every 60 to 90 days. I think I'll probably land somewhere around that 60-day mark for my scalp PRP. However, I will not be using a 10x PRP concentration. That seems a bit high. And again, I don't know this beyond a shadow of a doubt, but some of the literature suggests once you get past a 6x concentration, it actually has a little bit of an inflammatory effect as opposed to a regenerative effect.
Yeah.
So, I mean,
we like a 5 to 6x concentration.
Is it
we
worth
use a
that?
double spin. Double spin machine.
Yeah. So is it worth that extra sort of, risk if you know you can already get good results with a 6x? More isn't always better, I guess is what I would say. 120 cc's, that's quite a bit of blood, but if you're concentrating it that much, you're going to have to pull off a lot of platelet poor plasma.
Yeah, we pulled 30 cc's of our own blood this morning, and we did 5 to 6x concentration. We microneedled some of it in, all the way up to the scalp as much as reasonably possible, and even into the scalp to some degree. We microneedled, and we also did injections of both PRP and exosomes. We like the Benev adipose-derived exosomes. And we'll talk about our regimen more later, but there's certainly some similarities. We did not do dutasteride mesotherapy. When we do, we usually don't use 0.1%. It's a decently high concentration, and I'd bet that is going systemic to some degree to him. So it's kind of interesting. He's doing dutasteride mesotherapy, some of it's going systemic, and he's also doing finasteride topical, some of it's going systemic. Again, probably overcomplicated for the average person.
Be a little bit less hassle, again, if you're someone who is able to tolerate, I don't know, at least 90% of people, assuming if healthy hormone status, can tolerate oral finasteride or oral dutasteride.
Yep.
So it'd be a much simpler, probably better bang for your buck sort of regimen. And then we both forgot our laser caps. That's the next step in the regimen.
Yeah, I mean, if you're having all this, you're doing microneedling, you're doing injections, because if you look at the PRP studies, even when you use saline, all the little tiny injections from the syringes still actually have about half as good of a result as PRP.
Yeah, you're aerating the scalp like you would a lawn.
Yeah, core aeration. So it is for sure seems superfluous. I guess if you never wanted to microneedle, you never wanted to have any sort of scalp injections of any type, then maybe this could be reasonable.
It's sort of like a kitchen sink approach. It's like, well, you're just going to do every single vector that has shown some efficacy in hair regrowth. So at the end of the day, wearing a cap for this guy, maybe not that big of a deal. For me, I don't see the upside to it or the value for the small marginal benefit that I may get from that.
Yeah, definitely seems superfluous. And then he mentioned some markers, gray-white markers, and then he mentioned his Norwood scale. I can't remember if he's talked in the past if he's had a small FUE, like a small mini transplant.
I don't know. It wouldn't be uncommon in the circle of, tech and wealth for people to be getting some touch-ups done here and there.
Yeah, I probably would too if I was in his shoes and his...
Yeah, I plan to at some point.
Yeah.